Welcome back. When it comes to mental health, no question is too big or too small. So we're sitting down with an expert to answer all of our questions and yours.
She has spent her career in hospital emergency rooms and at Canada's largest mental health and addiction teaching hospital, CAMH, helping patients with a wide range of mental health issues. Please welcome psychiatrist Dr. Eloise Ballou.
Thank you. Dr. Ballou, we're so happy to have you here today. We got a ton of viewer questions, so let's just dive right in. This question's from Zachary. He writes, what are some telling signs that you have higher than normal levels of anxiety?
So I think the real test is about how are you functioning? How are you functioning compared to how you used to function? Because we define mental illness as when you can't cope when you used to cope. And so analogy I like to use is the bucket. And so you think of this bucket. And the bucket is getting filled and filled with water. And that's the stress level rising. And when it overflows, that's when you feel that you can't cope anymore. And that's when you've gone too far. So the size of your bucket, you don't really control that. Some people can take on lots and lots of stress. You may know those people. And it's amazing. They can just take it on and they're okay. Some people, their bucket's smaller. And so you add only even a sort of medium amount of stress, and then it just overflows and they can't cope anymore. So think of a valve, because the valve is what allows the water to flow out, and that's how you can then make sure that you don't overflow. And the valve you actually do have control over. And that's what sort of gives me hope, is that you may not be able to control your basic size of the bucket, but you can control things that will help release that stress. And those things are the things we all know, right? Sleep and exercise and having good people in your life and making sure that you do the things that allow that stress to release.
In terms of treatment for anxiety, at what point should medication enter the equation?
So for most people, when they have mild to moderate levels of anxiety, they don't need medications. Lots of other lifestyle interventions or therapies do the job. But if you have severe anxiety, in that case, you do need medication, and it works very well.
Here's a question from Mary. Mary writes to us, how do you help someone who doesn't see or know or think they need help? And I guess the second part of that would be, how do you take care of yourself to make sure that you are looked after?
It's so challenging because when you're living with someone or near someone who has mental illness, it is a huge stress on you. And you're focused on the other person. So you don't notice what's happening to you. And so I think that I have another analogy about the oxygen mask in an airplane. And they always tell you, put on your mask first, then help the child or the person next to you. And so it's the same thing with mental health. You have to make sure that you have enough oxygen, that you're able to function, and then you can help the person you want to help. How do you help someone who doesn't know that they need help or doesn't recognize they need help? You can't force them. And you can't make them recognize it if they don't see it. You can convince them and try to give them all the reasons that you can think of. And it's only going to make them sort of resist, right? So mostly you have to make sure that they know that you're there and that you're listening. And when they want help, that you're able to offer them suggestions. But it's about knowing the limits of what you can actually do to help.
We've got our next question from Melissa, and she writes, are there signs to look out for in young children that might indicate that a mental health issue such as anxiety is developing? And we'll take that one step further to perhaps teens who we think that adolescence in and of itself is a roller coaster ride. So how do we identify that there is a problem, and especially when during the tougher years it's hard to discern what is a problem, what's just normal?
Of course. So you know your kid, right? You know your child, and you want to keep an eye out for any major change. So is there a change in their personality? Are they suddenly much more quiet, much more withdrawn? Is there a change in their behavior? For example, they might become really aggressive, or just they don't seem like themselves. These are things that you want to watch out for. Changes in their grades as well. So if the teacher comments that something is, there's a significant drop in their grades, that's something that you should be worried about. The other thing that's important with kids that we often forget is that kids are not often aware of their mental states and their emotions. So often it'll come out in terms of physical symptoms. So they might get stomach aches or headaches. They might have nightmares. So all those kinds of things, you want to make sure you talk to a doctor to make sure there's no underlying medical reason. But often there's a lot of psychological reasons why those symptoms appear, and to think of those as a possible reason.
And teens?
So for teenagers, you do have that as well. With teens, it's often just more dramatic, right? Because teens in general, we all remember what it's like to be a teenager. Everything is more dramatic. So the changes in personality may be more dramatic. The change in their behavior might also be more impressive. But all teenagers, to a certain extent, go through periods where they feel alone and isolated and where life is tough. And that's okay to the extent that, as long as, again, it's not interfering with their functioning and they can cope. But when you're finding that they're sliding, especially into dangerous behavior, drug use, high-risk behavior, that's where you really want to make sure that you get help.
Here's a question from Kim. What are your options when you can't afford a therapist weekly, but a GP doing standard cognitive behavioral therapy isn't enough to help your severe issues? So, yeah, are there options for people who can't afford a therapist and they're in crisis?
For sure, absolutely, especially when there are severe issues. In those cases, you should talk to your family doctor or go to a hospital emergency room, and you can be referred to physicians who do provide psychotherapy or to counselors who provide therapy. There is an association in Canada called the Medical Psychiatry Association of Canada, and they have a listing online of family doctors who provide psychotherapy through their provincial funding, so that's free of charge. For people who have less severe issues, they can access online forms of therapy, which actually, for mild to moderate anxiety, are just as good as in-person therapy. So to think outside the box, to think more broadly about other online options or mindfulness, which many of you probably have heard of, which are very effective to help.
Lisa wrote to us and she said, what are some ways to balance the demands of a busy, deadline-focused career and your mental and physical well-being? I can go so long and then I completely crash despite getting enough sleep, eating well, exercising. It seems as though my brain can only take so much and then I experience cognitive issues with memory and comprehension.
Yeah. So here you want to think, again, of the scales, thinking of the balance. So when you're stressed, when you're having things that are demanding, your scales are tipping over this way. We all know what it feels like when you find that you're out of balance. And what can you do to balance those out? And so these are back to the things that we talked about earlier. Exercise, sleep, getting an actual 8 hours or 9 hours of sleep, which very few of us actually do. And realizing that if you can't actually lighten your load, you have to add activities and add things that bring balance to your life and making that a priority.
So what's the one tip for people who are watching right now that you would give in terms of just maintaining overall mental wellness?
One of the things that I really believe in and that the research totally supports is the importance of social relationships. And it's easy to forget that. Again, we talk a lot about our physical health and we talk a lot about how to work on your sleep and exercise, but we don't talk about the fact that every day we interact with people and we are social creatures. This is the core aspect of being human, is being social. And if you forget that, you become sick. And it's about looking at what are the ways to inject positive social relationships in your life. We all have people in our lives that we love to spend time with, but do we make time for that, right? Do we actually say, this is a priority, this is as important as my exercise or my diet, is making time for the people in my life who bring me balance. And similarly to that, you want to make sure that you think about the people who bring you out of balance, the relationships that you know are toxic, you know make you unhappy and unwell, and to be clear about what you can tolerate and what you can't, and limiting the time you spend with the people who make you unhappy. That's a choice that you have, and I think that that will have a powerful effect on your overall happiness.
Dr. Ballou, this has been so insightful. Thank you so very much. Keep tweeting. We'll be right back.